The prostate lives ventral to the colon, so that finding would not correlate. Okay, so prostatic disease can be generalized, both lobes, or it could be a single lobe. So unilateral, or asymmetrical, or symmetrical. So you have to think about what causes asymmetrical enlargement of the prostate gland. That means something is just on one of the lobes. And your number one is going to be prostatic abscess, prostatic cyst would be your first two benign lesions. The rest of them cause symmetrical enlargement. Now, which one causes pain? Look at this last bullet. Now, this is how I memorize this. Pain, P-A-I-N, pain. So what's the P for? Prostatitis. What's the A for? What's the I for? Infection, inflammation, which is the same thing as the P. What's the N for? And that's what you get. So those are the ones that cause pain on palpation. All right, this is an example, beautiful example of prostatic enlargement. So radiographically, markedly enlarged prostate gland, prostatomegaly. Soft tissue opacity at the brim of the pelvis, displaced in the urinary bladder and bowel loops cranially. That's pretty simple, right? Then you would have to say to yourself, next is, which one is urinary bladder? When you say that, because you got two soft tissue opacities. Which one is urinary bladder? You can assume that the urinary bladder is cranial if the prostate is hollow. Right? You're making that assumption. Sometimes when pets come in with soft tissue opacities in the caudal-ventral abdomen, you have to ask, where's the urinary bladder? Because if I did a contrast study, and this is actually the urinary bladder, then what would be that soft tissue opacity? Mass in the mesentery, whatever you want to call it, right? But I want you to add retained testicle. Retained testicle. And the reason why I'm bringing that up is because they typically stop right there in front of the urinary bladder. So dogs that are presented with multiple masses in the abdomen, just make sure if you're missing if you only can palpate one testicle, and you're thinking about a retained testicle, put that in your differential if you happen to see two masses, or two soft tissue masses. Retained testicle. So this is one with the contrast study. What did we say about prostatic disease? Did we say that it displaces the urinary bladder cranially? Well, what is this one doing? Displacing it ventrally. Is that how it behaves when both lobes are enlarged? No. So now it is asymmetrical. Now you just have one gland, one part of the prostate gland, one lobe that's enlarged. That's what asymmetrical enlargement looks like. It displaces the urinary bladder either ventral, dorsal, or off to the side if you're looking at it. Because if both lobes were enlarged, the bladder should go cranial. So that means now there's one lobe that is dorsal and the other lobe is somewhere ventral. And that's what asymmetrical enlargement looks like. If you look at the survey film, you just look at a large soft tissue opacity. Wouldn't you say that would be bladder? I would. That looks like urinary bladder, doesn't it? So just be aware that all soft tissue opacities in the caudal-ventral abdomen is not the bladder. And sometimes you have to do a contrast study. This happens to be an excretory urogram where you see the ureters, and then they're just going to fall course into the urinary bladder. Asymmetrical enlargement. As I stated, look at this one. This one was a retained testicle, but if I didn't have these labels, you would look at that and say, oh, okay, This is a male dog. You would say this is prostate gland and this is the bladder. If you didn't have these letters on it, that's what it looks like. So retained testicles can look like the urinary bladder. They usually stop right at the cranial margin of the bladder. So just do a simple contrast study. Remember, here's the prepuce, bright structure superimposed on the abdomen, and then this is the os. See the bony structure there? So that's the prepuce, not the bladder, because the bladder is going to be soft tissue and it's not going to be opaque, because it's a superimposed opacity on the rest of the soft tissue. Okay, prostatic neoplasia, we've already talked about that. What do we look for in addition to metastatic in the sublumbar region? Anytime you see dystrophic mineralization, that's usually badness. And everybody see this is prostate gland. Can neutered pets get prostatic neoplasia? Absolutely. So they're neutered to try to avoid that, but they still can get prostatic neoplasia. So what we see in the prostate gland is mineralization. Everybody see that? And in the bladder, you see multiple calculi. So you find this with mineralization in the prostate gland and multiple calculi in the urinary bladder.
How do you differentiate normal calculi from mineralized tumors?
Okay, so calculi are kind of focal, right? They're kind of round, like either they're irregular, and you see multiple of them. Look at this one. This is linear. So you would have calculi linear along the surface of soft tissue. That's how mineralization deposits. But a calculus is kind of focal, round. Have you seen calculi? Y'all done cystos? Not cystos, but yeah. And some people collect them. Actually, I used to collect them when I was a resident. I think I might still have some. But they're just beautiful, especially the oxalate. Just gorgeous. Have y'all seen those? And some of them just look just like stones off the, pebbles off the street. They look beautiful. Okay, got that? Okay. Walk with me. You can also jump ahead. It's good. All right. Label. Okay, now here's one that shows lysis. Okay, look at the arrows. If you don't see it right away, look along the ventral margin and see, don't you see the ventral margin, then that's an interruption on both of those vertebrae. So there's a lucency here, but look at this one. This was more obvious in L7. Ventral margin, then there is an interruption. So when you're looking at the spine, not only are you looking at proliferation, which is kind of easy to see, but look for those focal areas of lysis. If you see that, think about those 3 hot tumors first, and then you can go with the inflammation, infection, and then other causes. Okay, this is just another example, and there's mineralization. Now, see this one, this here has kind of this amorphous, it looks, just kind of spread out into the soft tissues. So that's soft tissue mineralization, not calculi, soft tissue mineralization. But look at the colon. Look how the colon tapers. So if it's tapering, that means that something is pushing dorsally, and then there's something pushing ventrally. So in this case, there's prostatic disease and lymphadenopathy. And the fact that you see the mineralization within it, you would think, okay, this is more likely prostatic neoplasia with regional metastasis. And that would be your radiographic diagnosis. What would you do next? Do an aspirate or a biopsy to confirm what you're thinking if you think it's prostatic. If it's prostatic adenocarcinoma, you confirm that, then off to oncology for them to work up the case further, if the client chooses to do that. Okay, enlargement of the uterus. Enlargement of, where does the uterus live? Where does the uterus live? Between the colon and the bladder. So if you see a soft tissue tubular structure, how about calling it uterus? Because that's where it is. So when the uterus enlarged, what happens? The colon is going dorsally, and it displaces the urinary bladder ventrally. Okay, I gave you several causes. Anytime you see a soft tissue opacity tubular structure between the colon and urinary bladder, please think of early pregnancy. Not just pregnancy, because once you see the skeletons 42, 45 days in the dog and 7 days early in the cat, then you know it's pregnancy as a cause. But if all you see is soft tissue, you have to put in early pregnancy or postpartum uterus. The difference between pyometra and endometrial hyperplasia, pyometra CH. Now all of these don't look alike radiographically. They're going to present similar radiographically. But what's the difference between pyometra and cystic endometrial hyperplasia? Depends on where the disease is. CEH is in the wall. Pyometra is in the lumen. So what would be the next step to determine which is which? Ultrasound. Because on regular radiographs, both of them are going to look the same. So let's not look at a uterus enlarged and then say, okay, we want to spay the dog. Especially if it's a breeding pet. Move to ultrasound and determine which is which. Okay. Count the fetal skulls. Once you count the skulls, I don't really care. You can count the skeletons after that. But give me a skull count. Give me a skull count first. Because if you're looking trying to count 14 feti, and they're all wrapped and on top of each other, even if you do a ventrodorsal, they cross in midline, you can pick up a skull pretty easy. And you're looking at a conical shape, well, semicircular shape opacity. And then where you see where these plates of the skull meet, that's the open fontanelle. Everybody see that little area there? Okay. Now, usually, if you're dealing with breeders, if you tell them that the pet is going to have 7 puppies or kittens, they better have 7. Why? Because they've already sold them. So I suggest, and you have to be very careful with that, even on ultrasound, when I'm counting, if I'm working with a breeder, they know that I might be off by 1, but I work with them and they're a special breed of people. If you're dealing with breeders, just don't scale, oh, let me just count. Because they have sold them already. If you're looking for viability, then you do ultrasound to look for cardiac activity. Okay, calcification, I already talked about that.
So with the pregnancy, if you have a daughter who's in dystocia, how can you tell whether or not you need to take them out or try medication?
Okay, if the dog comes in with a dystocia, you go to ultrasound first and see if they're alive. If they are, they go straight to surgery. You don't need to wait. You don't need to wait on this dystocia. Who wants to be pushing? Right? Well, I don't know about the guys, but us girl folks don't want to be pushing. Time to take it. I mean, we really have to put ourselves in the pet's space. I mean, that, really? Sure. And even in my experience dealing with serial genealogists, When I go in and do ultrasound, and if I don't see any cardiac activity, and I see cardiac activity on some are dead, some are alive. They can take the ones that are alive and get those through the distress. So don't y'all be waiting. Oh, let's just wait. No. Okay. Okay, here's a normal brevet uterus. So when do you say bring the pet in so I can count the fetus skulls? You want to, don't wait until right at 42, 45, because all you're going to see is just subtle mineralization. Wait till it's close to near term as possible. Now, if you want to know if the dog is pregnant on ultrasound, we usually do something like 25 days. If we're doing, for those of us who can do ultrasound and pick up the gestational sacs, we can pick them up as early as 18 days post last breeding. But for you as clinicians, I would say somewhere between about 25, 30 days, because you're going to see them. They're pretty obvious. Okay, so here's a case of uterine enlargement that happened to be palmitra. Look where the colon is located on the lateral view. See, the colon is pushed dorsally, gas field. Okay. Soft tissue tubular structures, ventral abdomen causing the colon to displace dorsally. And then this is another example of enlarged uterus. That's what you would call it first. And then you would do your differentials. This just happened to be other cases of palmitra. Okay, signs of fetal death. Signs of fetal death. Gas is your number one. When you start seeing gas, or physomitra, that means gas in the uterus, or gas in the fetus, okay, kind of dead. Overlapping, well, and then you got to go to surgery anyway, because you don't want all that stuff in there. So you got to take that, remove that surgically. Overlap of the frontal and parietal bones. So what does that look like? If you go back, remember I said the open fontanelle? So when the fetus dies, the brain shrinks, and then those two tables overlap each other. That's understandable, right? They overlap each other, and that's what we refer to as overlapping of the parietal bones or bones of the skull. If there's an abnormal angulation of the fetus where there is a dystocia, and the head is wrapped, pointing caudally, that one is probably dead. But you don't know for sure until you put an ultrasound probe on it. Typically, they're dead. Mummification means that the fetus died, but no infection. And they can live with that for long periods of time because there's no infection. And then what happens over the time? It's a nidus, and then it begins to mineralize, and then it looks like one mineralized mass. That's what is referred to as mummification. Okay, I think that would be physomitra and emphysematous fetus. Everybody got that one? And why? That's been a long time. I can imagine what it smells like at surgery. Okay, this is overlapping of the calvario bone. You see how this one is deviated ventrally, and then that one overlaps. Now that's a very subtle finding that sometimes you miss, but your number one is going to be gas as a sign of fetal death. Here's your dystocia. Do we want to wait on that one? I don't think so. This is a cat. So here's the head, and here's its cervical spine. Abnormal angulation. Okay. Alrighty. Okay, so I got to get through GI and urinary on Monday. Okay. I don't then. Okay, any questions for me? Yes, ma'am. Valid question. question, or that gives me, I'm being defensive before the question comes?
So, you said, using the ultrasound to look for cardiac,
Activity.
activities. Do you ever get like any, I guess it's like,
Okay, we're gonna help her ask that question. You're gonna help her ask that question?
Oh, no, but I did have a question.
Okay, let's not just slap her with her. Just overlook her. Let's do her question. Go ahead.
What I'm trying to say is, have you ever seen a clip like where you see that the fetus is dead, where you think it's dead as far as like cardiac activity, but
Okay, here we go. I'm gonna give you a nice fetus. Okay, here I go. Here's the fetus. I put the probe on one of those and I see what now? No cardiac activity? Do I see cardiac activity? None. Cardiac activity in the fetus.
if you see like, it's like a false reading, like, you know how you get like false,
Okay, either the heart is pumping. So cardiac activity is pretty easy to see on ultrasound. It's beating. It's active. But if you're looking in the heart and there's nothing, silence, nothing. Well, I think you got to live with a heart. I think your heart got to beat. Okay, I think you got it right. So is there false? What you're saying is that, did I see a fetus? I saw the heart not beating, and it was alive. I